1860, New York Medical College is a 163-year-old community of scholars that exists for the generation, conservation, and dissemination of knowledge about the causes, prevention, and treatment of human disease and disability. Chartered in 1971, Touro University is a 52-year-old university which provides educational opportunities and career paths to talented and motivated students, and has always shown particular attention to those who have been overlooked and underserved by higher education. But we know who have the drive and potential to succeed. New York Medical College has adapted with the times while remaining true to its core values. In Bryant Park in Manhattan, there is a large statue which honors our founder, William Cullen Bryant. We knew where he stood in the 1860s. Bryant thought that the great oppressors of the American people were racism, sexism, unconstrained business avarice, and the scourge of alcoholism. His response to this fourfold threat was to advocate for the emancipation of all slaves and their full voting rights for women, to support the right of workers to form trade unions, collectively bargain, and if necessary, strike, and the prohibition of alcohol. It made perfect sense that Bryant was a supporter of Abraham Lincoln and introduced him for the Cooper Union speech in New York City. Lincoln's campaign slogan in 1860 was "Free soil, free labor, free men." To Bryant and his proposals and ideology, these were all of a piece. When Bryant established New York Medical College, it was in his time, and remains in our time, a bastion against bigotry in health education and health care. The founder of Touro University, Bernard Lander, as a graduate student in sociology at Columbia University in the 1940s, wrote his doctoral thesis on the causes and prevention and remedies of youth gang violence amongst the minority communities of Baltimore. New York City Mayor Fiorello LaGuardia created a committee on unity by Mayor Executive Order in February 1944. Its purpose was, quote, to make New York City a place where people of all races and religions may work and live side by side in harmony and have mutual respect for each other, and where democracy is a living reality. Lander was a staff researcher for that committee. One might well imagine that Bryant and Lander would have much to agree upon. New York Medical College and Touro University are defenders of respect for all and a place where there are no hyphenated people or patients for our caregivers. There never shall be such a thing as an illegal or undocumented patient. Human beings never were and never will be illegal. And when human beings are ill, they are our fellow humans in need. Discrimination against people by trying to place the blame on a pandemic or the social determinants of health or disease upon them or their race or their religion or their sexual orientation, whether in ancient times or in the present, was and is evil. Othering people is wrong. Making a group an other and asserting that they do not belong here is a serious evil. And we have tragically seen over and over that othering via so-called replacement theory reminds us that words can kill and mutilate and maim. In 1865, this School of Medicine graduated Ira Remsen, the discoverer of saccharin and the second president of Johns Hopkins. In 1867, we graduated Emily Stowe, the first woman physician in Canada who was rejected by the University of Toronto because of her sex. In 1870, we graduated Susan Smith, the first black woman to earn an MD in the state of New York and the third in the United States. In 1921, we appointed Israel Simon Kleiner, dean of this medical school, the first Jewish dean of a historically majority medical school in the United States. In 1926, we appointed the first woman chair of a biomedical science department, Mary B. Stark, the discoverer of metastatic cancer in Drosophila. In 1933, after 2 years of walking the wards of Metropolitan Hospital, we graduated Myra Adele Logan, the first woman to perform open-heart surgery in the world and the second black woman to be elected to the American College of Surgeons. In 1945, we graduated Jane Cook Wright, who also walked the wards of Metropolitan for 2 years, and she became the first black dean of a historically majority school, this one. In 1946, we appointed Lois Lillick, the chair of microbiology, the second woman chair of a biomedical science department in the country. In 1978, Kathleen Morton became this college's president, one of the first women presidents of a historically male majority higher education institution. It is worth remembering these first women of our college's history because the graduates of this School of Medicine have been taught that all adults with capacity have the right to make their own decisions about their own health care in concert with their physicians. And therefore, in light of our history and in light of current events, it seems necessary for me to point out that while some people do not seem to understand the definition of all adults, at New York Medical College, we do, because we know that the words because at this college, we know that the two words, all adults, includes women. This college began admitting women to medical school in 1862. By 1932-1933, at the height of the anti-Semitic admissions quotas for medical students in the United States and Canada, the most Jewish medical school in America was New York Medical College. Our college is among the most diverse of its type in New York, and one of our major teaching hospitals, the Metropolitan Hospital, was named the most diverse in the United States. Over the past 60 years on this Valhalla campus, we have grown schools where we grant the degrees Doctor of Medicine, Doctor of Dental Surgery, Doctor of Philosophy, Doctor of Physical Therapy and Public Health, Master of Science in the Biomedical Sciences, Master of Science in Bioethics and Clinical Laboratory Medicine, in Speech Pathology and Public Health, and certificates of competency in multiple disciplines. And we have developed a robust program of graduate medical and dental education and continuing education, and we are proud that all of our programs have welcomed students of all backgrounds. At this institution, we shall defend the proposition that this world is full of our fellow and equal human beings. All are equal members of the human family, and sometimes our fellow humans are in need of prompt, expert, and humane care. And sometimes we will be the ones in need of that care. We will treat others as we expect to be treated. We know where our founders stood. We know where we stand. The prophet Jeremiah advised us, "For he shall be as a tree planted by the waters, and that spreadeth out its roots by the river, and shall not see when heat cometh, but its foliage shall be luxuriant, and shall not be anxious in the year of drought, neither shall cease from yielding fruit." If you do not remember that verse, you will remember how the song goes. Just like the tree standing by the waters, we shall not be moved. Dear graduates, this faculty has sought ardently to educate. You have sought ardently to learn. We arrive at this day together in partnership. We are proud of what we have jointly achieved. While you have been with us, we have striven to impart both values and knowledge because wisdom is at the confluence of knowledge and values. We confidently send you forth well prepared for the challenges posed by your respective disciplines. As you go forward, I charge you to commit yourselves to the highest professional and ethical standards, to render to each person the dignity that is rightfully theirs, to remember that you are stewards of the connected human family, to be compassionate to those in need, and to remember with pride New York Medical College and Touro University, as we shall proudly remember you. My dear young doctors, Godspeed on your journey.